Last year, AKU research attracted more than $65 million in funding. This work was cited approximately 70,000 times.
What can a research university do for the people of Asia, Africa, and the world? At AKU, it's a question we're answering every day.
We can use artificial intelligence to identify people at risk of future health problems.
Together with the University of Michigan, AKU is using AI to help identify women at risk of pregnancy complications, as well as individuals at risk of depression. The project has already received $6.5 million in funding from the National Institutes of Health in the US.
We can conduct large-scale nationwide studies that shed new light on teaching, learning, and assessment.
To assess the state of math and science education in Pakistan, AKU researchers tested 15,000 students and observed hundreds of teachers at work. They found that few educators use the kinds of teaching methods that improve student performance. Now, the university is training hundreds of government math and science teachers in the use of effective pedagogies.
We can show how much more complex the past is than most people realize.
Professor Philip Wood's book, The Imam of the Christians, analyzes the fate of the Christian church in Syria in the 8th and 9th centuries. Wood shows that the church actually gained power during the period thanks to its good relations with the Abbasid Caliphate.
We can generate the evidence that impacts policy and helps save millions of lives globally.
In 2019, Pakistan became the first country in the world to start using a life-saving new typhoid vaccine. AKU researchers made that milestone possible by conducting the first large-scale field-based study of the vaccine's effectiveness.
We can help journalists to provide the public with crucial information and analysis.
Digital technologies continue to disrupt East Africa's news industry. Studies by the Graduate School of Media and Communications reveal how the media is responding and what the future might hold for the journalism profession.
We can address the big changes transforming societies, from climate change to population aging.
In Tanzania, AKU's Arusha Climate and Environmental Research Center is bringing together researchers and students from around the world to study climate change. In Kenya, AKU is conducting the country's first major long-term study of aging, and it's contributing to a groundbreaking international study of Alzheimer's disease. AKU can also save thousands of lives by working at the cutting edge of science in both the community and the laboratory. In rural areas of Pakistan, researchers reduced newborn deaths by a remarkable 25%. They did so by partnering with community health workers and government health facilities. In Kenya, the university and its partners have an even more ambitious goal: to reduce newborn deaths by 50% across 140 hospitals in 5 countries. Meanwhile, in the laboratory, faculty are working to develop new treatments for deadly blood disorders using gene editing technologies such as CRISPR.
In the last 40 years, AKU research has impacted close to 6,000 policy documents by major influential organizations.
With the help of our partners and supporters, we're going to continue to demonstrate what a research university can do for Asia, Africa, and the world.